Last year, BC's top doctor, Bonnie Henry, commissioned a report from an American drug policy expert examining the economics of safer supply diversion. The document, which was completed in March, was quietly uploaded to the provincial government's website in July. And oddly enough, while the report has generated significant public interest, its release was unaccompanied by any government announcement. And this morning, columnist Zivo published a troubling synopsis of the report in the National Post. And he joins us now to discuss it. Adam, thank you for joining us.
Thank you for having me on the show.
Now, what does this report say about safer supply?
Well, so the BC government commissioned a American drug expert to take an economic analysis of safer supply and see whether it was theoretically likely that safer supply drugs would be diverted. What that means essentially is that we give out these free opioids to try to dissuade people from using street substances. We often give out hydromorphone. An opioid is potent as heroin, but they're often just sold on the street instead, so people can make money to buy stronger street drugs. The American expert concluded that it was more or less inevitable that large amounts of safer supply would be diverted in our current model because we give it away for free or at low cost, and these opioids do have a street value. He said that we can expect there will be profiteers who will be engaging the system, and that organized crime will likely be involved to a certain extent as well. He expressed concern about drug traffickers smuggling safer supply from jurisdictions where it's easily available and reselling it at a profit in other jurisdictions where it either doesn't exist or is much more restricted. So that could look like, for example, trading safer supply across the nation or exporting it to other countries, things that we've seen examples of already, to be honest.
And why do you think the provincial government is burying this report?
Well, the problem with Bonnie Henry, who is the top doctor who commissioned this report, is that she's an ideologue. She is a staunch advocate for drug legalization, regardless if there is any evidence for it or not. So around the same time that this report was quietly uploaded, she published a report calling for the legalization of all drugs through non-medical safer supply, essentially selling drugs as if they were alcohol or cannabis in stores. I mean, that was one thing that she advocated for. And what was interesting in that report is that there was no real evidence showing that that kind of model would have any benefits. There was no evidence base at all. It was all just theoretical. And in her past comments about safer supply, it's obvious that she is not following the science. She's ideological, and seems to be manufacturing evidence to suit whatever her agenda is, even if her agenda is reckless and could harm individuals.
Now, if you're saying that there's no proven benefits yet, why does this report matter across Canada?
Well, so I've spoken to over 100 people who have expressed concerns about safer supply diversion, whether it be addiction doctors, whether it be former drug users, whether it be active drug traffickers. And the BC government and the federal government continue to insist again and again and again that this is not a problem, that this is being exaggerated, that diversion has always happened and there is no crisis. And over time, I've been able to show again and again and again that it is a problem, that it is causing new addictions, and that it is ballooning the street supply of opioids. For the BC government to commission a report which validates the concerns of critics of safer supply and then to try to bury it by basically removing it from the website, it's very difficult. It's almost impossible to find unless you know exactly what you're looking for. I think betrays a certain level of awareness of what they're doing, right? I think that when any government commissions a report that comes to conclusions that they don't want, and then they downplay that report and make it very difficult for the public to find that report, that's concerning for anyone. We should have evidence-based policymaking, right? The public should be aware of the potential downsides of any high-risk policy that we have.
Now, you've mentioned that you've brought this topic up countless times, but do you feel that politicians are listening to your concerns regarding diversion, and what can be done in your view to prevent diversion?
Well, I mean, the easiest way to prevent diversion is to require supervised consumption of any safer supply drugs. Right now, we just hand people bottles of pills and say, do what you want with them. We trust you to take them as intended. And obviously, with drug users, that doesn't work out. I think that there's ideology. There's a lot of ideology involved here. Many public health bureaucrats, they really want legalization. And on the political level, I think that the Trudeau Liberals and the BC NDP understand that if they were to acknowledge that they have championed a program that is flooding communities with opioids and getting kids addicted, that would be ruinous for them electorally. So I think that they're doing whatever they can to downplay this issue.
Adam, thank you so much for joining us today.
Well, thank you for having me on the show. It's always a pleasure.